you have been married for more than 1 year and trying to conceive and have not got success as yet, you should consider evaluation of both husband and wife. Coming to evaluation of wife, first we need to do a transvaginal scan of wife, in which we will assess the ovaries for presence of PCOD, endometriotic cyst, simple cyst or hemorrhagic cyst. We also evaluate both the fallopian tubes for any gross abnormalities and uterus for presence of any fibroid or adenomyosis. We would also like to check the egg count in both the ovaries together, which is known as antral follicle count. Coming to the male partner, we need to do a semen analysis in which we would check for the sperm count, sperm morphology and sperm motility. And lastly, we need to evaluate all the blood parameters of both husband and wife, which is related to infertility. After getting all the reports, we will sit with the couple and counsel them both in detail, following which a treatment plan will be laid and you can go ahead with the treatment.